Okay, I want to talk more to this having to pee during the night thing. But first, I want to step back and talk about getting up in the middle of the night in general. Somebody that finds themselves on a regular basis waking up, say, between 2 and 4 in the morning, how common is that? And what's at the root of that?
It's quite common, actually. You see, throughout the night, we tend to go through all the sleep stages several times, 4 to 6 times. And waking up at the end of one of those sleep stages, cycles, is actually fairly common. And it might be 30 seconds that they're up, they fall back asleep. They may not even have realized they actually woke up. Okay, so now sometimes those awakenings could be a little bit longer. They actually come to consciousness, and it could be triggered by many, many different things. Of course, sleep apnea, stress, acid reflux, the GERD, heartburn, the need to pee, of course, a lot of different factors. Caffeine use is a big one here. Caffeine too late in the day. Alcohol is a huge one too, especially if alcohol is consumed within 3 hours of their bedtime. Alcohol, one thing on alcohol, probably the most commonly used sleep aid worldwide, but it's a terrible sleep aid. It might help you fall asleep initially, but you'll struggle to stay asleep throughout the night, and the depth of the sleep is compromised too. So we call it sleep architecture, how the quality of the sleep, and it's definitely impaired in individuals with alcohol consumption.
For somebody that you named a number of causes there that could be at the root of waking up during the middle of the night, for somebody that can't really get to the root of that, but it's happening on a regular basis, any strategies for falling back asleep? If they find themselves lying there for an hour, 2 hours go by, they start stressing, they're missing out on their sleep, what can they do in the middle of the night to get back?
So after 20 minutes, you haven't fallen asleep, and you don't think you're about to fall asleep in the next minute or so, leave the bed. Just leave the bed, go to a different room. Don't turn the lights on too bright, but do something. Do some activity that's not too exciting, too stimulating. Don't watch TV. Um, I think like something like read a book. Maybe do, if you like to knit, maybe do some whatever activity that's to the individual and their hobbies. Okay, do some activity, and then generally you'll feel that wave of sleepiness come over you. Then go back to the bed, ride that wave, and try again. But if you're getting the feeling of frustration, man, or the dread, oh, what's tomorrow gonna be like if I don't fall back asleep? Once those feelings come, it makes it that much harder to fall asleep. So don't fight it. Just leave the bed. Because what can happen is night after night, if individuals are spending this prolonged time awake in bed, our brain gets reconditioned. We want our brain to associate our bed with sleep. But over time, if we start to associate the bed with all those times I'm laying awake, all that dread, all that frustration, all that boredom, or whatever, that is going to be counterintuitive now, because now your brain will just see the bed, and suddenly all that comes right to the forefront, and then sleep your opportunity for sleep is going to be restricted. So leave the bed. 20-minute rule. That tends to work pretty well. That's a fundamental part of this program called cognitive behavioral therapy for insomnia, often abbreviated CBTI. But this has been shown clinically to be one of the most effective ways to treat insomnia, even better than sleeping pills, especially in the long run. So that's a big one. And then be mindful of what you actually do. Don't get your heart rate up. Don't get too excited. TV, be mindful of that blue light. Sometimes even just changing the color of your bulb can make a difference. So let's say someone wakes up because they have to use the bathroom. And then when they're in the bathroom, they're turning on that bright white light. That could be a problem. So having a red hue bulb, that in itself would be a lot less stimulating to the brain. And then avoid food. Remember, we talked about food is a potent Zeitgeber. So if you're eating in the middle of the night, you're telling the brain, I'm supposed to be awake right now. And the brain is going to behave just like that. So avoid the food, of course.
Whether it be in the middle of the night having trouble falling back asleep or having trouble falling asleep just at bedtime, how do you feel about meditation as a tool?
Meditation is fantastic. Okay, if we did an EEG, looking at the actual brain waves of that individual, we're seeing that the brain waves, which are really fast when they're awake, we call them beta waves, very fast, and then they start to slow down, slow down. Slow waves are good. Slow waves are good. So there's that. Clears the mind as well. If we're thinking about 1,000 things at the same time, it makes it very hard. And it can actually even relax the body too, because we're being mindful of our breathing, prolonged exhales. You may have heard of the vagus nerve, largest nerve in the human body, part of the parasympathetic nervous system, the part of our autonomic system that promotes relaxation. So just that, we are relaxing the mind and body simultaneously. If our body is tense, our mind is more likely to be tense. So that's why yoga and meditation go so well together, because the yoga relaxes the body, which therein relaxes the mind, which helps the brain achieve a deeper meditation too. So that before bed is a fantastic idea.
I want to come back to having to pee during the night. So you mentioned the fact that you feel prostates are being blamed too much. What are the different causes you see with people having to pee during the night? Obviously, if we're drinking too much before bed, but if somebody's saying, okay, this isn't the prostate, I've had that ruled out, there's no challenge there, I'm not drinking before bed, but I keep waking up to pee throughout the night and it's just disrupting my sleep. Any other causes there?
So don't drink too much water. 2 hours before bedtime should be the cutoff. Okay. And it's not the prostate in this case. So then we have to look at blood flow. Okay. And this is where sleep apnea once again comes into picture here, because I'm going to explain the physiology here, because this is fascinating. So imagine in sleep apnea, the person is effectively being choked, right? So it's choked up here, but they're still trying to breathe. If you look at their belly's still moving up and down, just like someone who's being choked. So when the glottis here is closed, but the diaphragm moves down, I'm trying to inhale. That effectively creates a vacuum. Okay, so think of a negative pressure within my chest. So if I look at blood flow towards the heart, the blood flow actually goes up. There's more blood coming into the heart. So by volume, there's more blood that ends up in the heart. So the heart, like a balloon, is getting overfilled. The balloon is getting stretched. Now here's where it gets really interesting. When the heart is getting stretched, it releases a hormone. That hormone is called ANP, atrial natriuretic peptide. And that hormone then goes to the kidneys and it sends a signal. And the signal it gives the kidneys is, hey, the heart said that there's too much pressure. There's too much volume in the heart. There's too much pressure. So what does the kidney do in response? Too much pressure, too much volume? Okay, I need to release some urine and bring that volume down. That is the mechanism by which a sleep apnea patient has to end up going to use the bathroom multiple times in the middle of the night.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
This is an alarming study. If you take a group of individuals and you limit them to less than 6 hours of sleep, and you were to check